Thank you for joining us in breakout room number 2. The impact of COVID-19 and efforts to vaccinate our communities. After decades of fighting for meaningful relief for the 11 million undocumented immigrants, we now have the best opportunity to realize a comprehensive immigration reform package. Democrats are in control of the 3 branches of government, and advocates have the opportunity to push through a generous legislative package. In this session, you will learn what you can do to help make legalization a reality. Hello, I'm David Cruz. Welcome to this very important panel. We appreciate your attendance and hope that by the end of this conversation, you're going to be better informed and more knowledgeable about not just COVID-19, its impact on our community, but how we can overcome this new phrase I hear so much about, vaccine hesitancy. That is a counterproductive mindset that we must address, and this is why I'm so excited to be able to bring you this conversation with our esteemed guests. In no particular order, but let me share with you who is joining us today. We have Dr. Melissa Pluguez. She is the member here representing the National Association of Hispanic Nurses. Doctora, thank you for being here.
Thank you for having me today.
Aracely, Panameño, Director of Latino Affairs for the Center for Responsible Lending. Aracely.
Un placer estar con ustedes.
Thank you very kindly. Also, I want to introduce Dr. Ilan Shapiro, who is here with us, and he is out here in California, the National Hispanic Medical Association. Doctor.
Un placer estar con ustedes.
Thank you. And Dr. Rodolpho Galindo, he is Assistant Professor of Medicine at Emory University. Dr. Galindo.
Thank you very much for the invitation. It's a pleasure to be with all of you.
So let's begin at 22,000 feet. Your assessment of where we are today. I'd like to begin with Aracely. Where are we today when it comes to the notion of COVID-19? What is it that we know, and what is the impact it's having on our community?
So the impact that COVID is having in our communities is quite cutting across all of our lives. We are not the sum of our parts. We are whole persons. And so where we live, how we live, where we work, what we do for work, who is in our household, who can live and work from home, and who has to go outside of the household. All of those things actually set up the stage for the impact of COVID in our lives for our Latino communities. We know that our Latino communities have lives that require most of them for them to work outside of the household. And so therefore, they are more likely to come across people who have the virus and contract the virus themselves. We also know that our community has the lowest level of insurance coverage and access to jobs with insurance coverage. And so therefore, this impact of health cuts across multiple aspects of our lives. The types of work that we do, usually in construction, in service jobs, where we are interacting with the public, that also happen to pay less wages as opposed to annual salaries with great benefits. And so all of those things have an impact in our lives, in our health, in also our mental and health, as well as our human health, right? So mental and emotional health status.
You know what, Aracely, my father used to say, because I would ask him, I would say, you never get sick. And he would say to me, el trabajador pobre nunca se puede enfermar. The poor worker, the worker who is struggling to put food on the table, does not have the luxury of being able to get sick. So I appreciate your opening comment about the intersection of economics and health. Let me move to Dr. Melissa Pluguez. You represent the Hispanic Nurses Association for this call here. My question to you is based on having 2 daughters who are in the healthcare field. It is such a vital role. Where do you see the situation today with COVID-19 in our community, the big picture?
The big picture in reality is that there is a disproportionate number of our Latinx community that are affected by COVID. And again, mentioning the fact that it is an economic cross-sectioning that happens. So when that person's hospitalized, when that person's under treatment, it could be that they haven't received sufficient primary care because they don't have enough resources to go to primary care. So they come in usually sicker. They come in with more medical needs. They come in leaving their families behind, trying to struggle and find a way to obtain day wages, either on their own or live off, the assistance of other family members. Reality, we're in a serious crisis mode right now when it comes to serving our Latino population and being able to provide them sufficient care for COVID-19.
We are so indebted to the work of your members and your association, the frontline workers, the nurses who are out there each and every day. Thank you for what you do and the association you represent. Dr. Shapiro, I know that you in California, where I also am at this time, we see what's happening in Southern California. You've been out there on the front line. You talk about the importance of engaging community. How significant and how well are we doing it at this time?
Well, there's a lot of efforts, but the reality is translating a document, translating a piece of paper from one language to another, and just figuring out that it's grammatically correct, it doesn't correctly picture the entire culture of our community. Then we need to start engaging in a matter that is very important. I had the probability and actually possibility a couple of weeks back to be part of a phone bank, and it was a COVID-19 phone bank in Spanish for our community. Most of our participants were asking about rent, they were asking about food, and how to get basic healthcare needs, not for them but for their family. And by the way, yes, there's a pandemic. Then we have so many things right now that we need to cut and transmit information to our community on a way that is culturally sensitive. Yes.
Yeah, so let me see if I get what you're saying. Are you telling me that simply translating words may not always cut across the cultural understanding?
Completely, because our communities right now are in a survival mode.
Yes.
We are trying to fight the day-to-day things. We're out there, we're doing public transportations. We're sometimes, it's not a miracle that our kids are one of the most highest affected on the entire country. Why? Because we're out there, we're exposed, we're bringing it back home. Then we need to make sure that any message that we're creating for our community is culturally sensitive and relevant. It's very important, and on a way that we can actually deliver. Why? Because it's not that they will have an academic or will have an academic debate. They just want to have the information that to protect their families. And we are very, very far away of actually reaching that goal right now. One of the things that I tell everybody that we need to start vaccinating our communities against fear with a dose of truth. And that's what needs to be the objective for us.
That is so beautiful. Thank you, Dr. Shapiro. Dr. Galindo, you're in another part of the country altogether. And I know that one of the areas of your medical interest and research has been people with chronic disease like diabetes. Talk to me about, and again, we're beginning with the big picture. What do you see? What goes through your mind and heart every day?
Thank you very much, David, for the invitation, and LULAC for advocating for our communities. If we don't do it, who's going to do it for us, right?
¿Quién lo hará?
Right. So for me, it's a little bit challenging. So I'm facing every day the Latino population with diabetes, right? So and diabetes affect our communities. More patients, more complications, higher disease, severity of disease as well. And then with regards to COVID, it's not that because you had diabetes, you're more likely to get COVID, but you're more likely to get severe COVID. So and then if on top of that, you have limited access to good medical care, because it's not just having insurance, right? So many patients have insurance and they can still not afford good medical care. And the system is complex. Complex in translation, as my colleague Shapiro was mentioning. So navigating the health system with insurance is complex. Imagine with a limited language proficiency or or not a cultural appropriate ways to find the answer and the services that you can afford. So basically what I'm seeing is from my community, from my practice, is a highly affected community by a severe disease that is spread really quickly and affect the more vulnerable. So we need to keep advocating and trying to make it better. And again, I'm going to repeat myself. If we don't do it for ourselves, who's going to do it for us, right? So.
Thank you, Dr. Galindo, for that opening observation. So as you, the viewers, can see, this is a very dynamic and fluid situation with many moving parts. It's not one simple thing. I almost feel like we're playing 3D chess and the target keeps moving. I want to come to Dr. Melissa Pluguez, again, because you're in that frontline area with the Association of Hispanic Nurses. It sounds and seems to me like when we talk about the Biden administration's ideas about the vaccine rollout, I mean, there's a policy part of it, but where the rubber meets the road, what are your members telling you of what they're encountering in those minutes that they have with every patient in clinics all across America and hospitals? What are the nurses seeing in their contact with patients? Melissa?
The nurses are seeing just a real difficulty in having the information available to even give to their patients. So we are receiving information about the rollout, what's happening nationwide, that there is an effort to make sure that these vaccines are available with more time, so that way locations can book appointments appropriately, because we have seen some disasters already where patients are waiting for a long period of time and then not even being able to get the vaccine. But then, you know, as we've repeated, having that information readily available to give to our patients in Spanish is exceedingly complex. The websites for some of these institutions that are offering these vaccines or large vaccination centers, again, exceedingly complex. It takes us some time to be able to try to get through some of these websites or try to manage some of the links that they provide for us, to then be able to go ahead and turn that information around and explain it to our patients and have that time. You know, many times they're working off a cell phone, that's their only computer access that they have. They don't have a laptop to be able to really see when you're trying to download a lot of this information. By the time you make it through all of that, honestly, appointments are booked. If you get a link and that link has gone to everyone, that appointment is booked, and you're possibly either looking, you know, months out, or the system has crashed, or there's just nothing available anymore. None of it's in Spanish. You know, this is heartbreaking in reality for the efforts that we're trying to make. And initially when we get in these links, it was for people to try to get it for their own family members. You know, how do I get my suegra? How do I get mi abuela to be able to sign up? You know, because we're all local and we all live in communities, you know, with our own family members. So even treating what we consider our own blood is nearly impossible, much less than trying to turn the information around for our patients, because we love our patients as much as we do our own blood, and we want everyone to have access to the vaccine. And it's just not working out that way. It's really heartbreaking.
Dr. Pluguez, thank you for your honesty and for the accuracy of the picture you're giving us, because the purpose of this conversation, ladies and gentlemen, is to give you a real-time look at what's happening across America and Puerto Rico's landscape. This is the real deal. Dr. Shapiro, in California, Southern California, where you and I live, I would have thought we would be cutting edge, we would be completely prepared to deal with it. But the situation has gotten to the point, if I may, we're not here to discuss politics. There's even an impeachment effort underway of the governor of California. That's how upset people are about healthcare not reaching Latino communities and others. So my question, and following up on Melissa's point, what are your thoughts on the Biden administration's actions to make sure that the vaccine is reaching our communities?
I can tell you for sure that the coordinated efforts and everything that it's happening, it has been day and night. One of the things that we have seen is that, you know, we need to understand that the federal government actually does a big the big buyings of all the vaccines that we need. And
Yes.
every state actually has the flexibility to follow up the CDC guidelines and understand what's actually happening on the ground. One of the things is it's all about access and equity. We know that if we are not taking care of the Hispanic community, that we are first line, workers. We are out there, making sure that's meat packing, agricultural workers, people in services, people in hospitals, that we are maintaining a lot of that line that actually is holding our society. If we don't reach them, our community, with that vaccine and start the healing process, right now, we're not going to start the healing process. It's impressive that, it took me, I checked the Texas website, the California website, and Florida website to see if I'm a 65 plus that has internet access that speaks only Spanish, how far away I can get until I just do English, because that will be my hard stop. And it took me, in the three of them, it was a fail. It was a fail. And I tried at the same time to call the telephone numbers to actually do access, to call in Spanish, and it was a fail. Then we need to make sure that we are opening fair qualified health centers, community services, community clinics, hospitals, people that are already there, promotoras de salud.
Eso.
That we will need all the help in the land.
And by the way, Dr. Shapiro, I speak, and I see you have Ultimate on your clothing. They're one of the most respected FQHCs in America, the front line of healthcare across our country. Thank you. Aracely Panameño, the Center for Responsible Lending. We've been hearing much that affirms what you were saying earlier, but now let me give you a real life situation. I live in a community of essential workers. I live along the coast between LA and Santa Barbara. And I know mama y papa, mom and dad, they're having to go to work in the fields and las empacadoras, wherever it is, shipping food to America because, we're not closing down those plants. How do you balance the economic reality with the health urgency? Some are postponing their care. Some of them aren't even getting it. Talk to me about that.
Absolutely. They are making life survival decisions. Many people are choosing to earn a day's income to make sure that they're able to put food on the table for their families, keep a roof over their heads, over their own health. That is, and I don't have to actually go too far. That is the situation that I have faced in my own household. I have shared with all of you, I have now survived COVID because one of my brothers lives in my household. He actually has to go outside of the home to work, and that's how he contracted the virus. He has underlying conditions that have been mentioned, so therefore his experience with COVID was significantly more severe than mine. And so these are very difficult decisions. So having insurance coverage is not the end of it. Is that pressure the person has? Do I have the time to take off from work to actually seek care? Do I have, he ended up being in the hospital for 10 days, all total out of work. He was 1 month out of work. And so are the policies of the employer going to allow for each employee to come back to work when they are able to come back to work after they heal? These are all real situations that are making us evaluate our life, our well-being, and the ability of us to survive. The policies that the Biden administration is pushing forward incorporate a number of allocations of dollars, significant dollars. The bill that is being talked about right now at the federal level has $1.9 trillion. It puts monies not only into the vaccination program to make sure that we're able to produce, because production is quite important, as well as allocation to states and localities, but also all of those other issues that we're talking about. Will there be money available to provide rental assistance, mortgage assistance, for the homeless, food programs, All of these things are very, very important. Will our children be able to go back to school? Will the school setting be safe? Will the teachers be able to have access to the vaccination program? And if they get ill, will they be able to actually receive the treatment that they deserve and need in order to actually come on the other side as healthy teachers to teach our children? These are the issues that we are facing right now. This administration, as has been said already, is night and day in terms of putting the lives of Americans as a higher priority and making sure that the policy reflects that.
And I appreciate your comment, and I've heard it also from someone else night and day. That may be true in DC. That may be true at the federal level. We need to make sure that in the execution of this across the states and down to the local level, that is also being followed through, Aracely. Thank you for that. I want to reset the conversation. This is the state of Latino America. This particular conversation is centered around a theme that is very timely, COVID-19 and efforts to vaccinate our communities. So we have our guest today, Dr. Melissa Pluguez. She is with the National Association of Hispanic Nurses, Aracely Panameño, who is with the Center for Responsible Lending, Dr. Ilan Shapiro, the National Hispanic Medical Association, and Dr. Rodolpho Galindo from Emory University, all respected authorities in the space. Let me go to you, Dr. Galindo. Acute care for people who have a combination of medical challenges. I have a brother who has diabetes, chronic diabetes. If COVID hits him, the care, I'm sure, is going to be much more intensive, much longer. What do you see in that perfect storm of the worst ever conditions, diabetes, COVID, age? What is that doing economically? You heard Aracely talk about the family level. Talk to me about the institution.
It's a challenging moment for everybody, but again, our community is being affected more. So the Latino population with diabetes is already facing higher severity of disease, and if they get COVID, there are higher risk of having severe COVID disease, and that's the one that is scary, right? So that's the one that is concerning. We know that COVID, some patients are asymptomatic, but if you get severe COVID disease, mortality is high. And we had really bad cases. Last week, we had a very young patient dying in the ICU with 31. It was 31 years old. So we don't expect that we don't see that every day. So doctors are also.
Okay, stop there. Let me ask you this. 31-year-old gets it and you say severe and dies. Please describe to me the three things that may have been the most of a factor in that outcome.
So the conversation came from one of my colleagues in the ICU who was very affected by this young guy, happened to have been a Latino guy, with morbid obesity, right? So he had excess weight. And obesity is a misnomer. I hate the term. So now we call it adiposity-based chronic disease. It's a chronic disease for excessive fat tissue deposition. It's not obesity. It's more complex than that. But anyway, so he was very young. As expected, you should supposed to be healthy, but he got chronic conditions, right? So he got obesity. He had diabetes. So didn't make it, and it was affecting the whole team because you don't expect to have a young guy dying in your ICU under your care. You didn't go to medical school for that. You expect the best, but this disease is really challenging and really concerning. What I tell my family, my friends, and my patients, it's not about you. It's not about who is next to you. It's about who could be around you and even a little bit further away. So meaning, whatever decision you make for yourself, you need to also take it for whoever can be around you. You need to make a personalized risk assessment. It's no longer about how good I am or how much money I have or how good is my family, because your family has extended contacts. So you need to make a personalized risk assessment.
Can I ask you? I want to ask you a quick follow-up, and if I could get a brief answer, I want to get bite-sized answers to get more info. Let me ask you this, Dr. Galindo, and forgive me, but I really need to interject a question. when you face a patient like that who has very acute needs, I mean, very, very intensive, and then you've got four others over here whose survivability may be higher, what do you do? What do you do when you're faced with that tough decision, when you have limited resources?
So doctors have an oath, right? And it's always first. Reality is that resources sometimes define what you can do, but we
Yes.
always follow our oath. But we are not magicians. We are not God. We're just doctors, and there is a team in between. We have nursing, we have social workers, we have psychology, therapy. So we have many other members of the team, and this disease is very complex. It's not just when you get really sick. It's after you survive the disease, the long-term effects, right?
The lingering effects.
Right. So again, so we follow and we, try to stick to our oath, but reality, resources determine. And I work in a county hospital and I work in a private hospital, so part of the whole university system. And of course, resources are not the same.
Okay, well, I thank you, Doctor. I really do, and I must press Dr. Melissa Pluguez on this. You and the nurses, there you are. I think earlier someone said the websites are tough to navigate. Without this, estoy ciego. I'm blind. I cannot see sufficient to see the letters. Now someone is holding this as their way into the internet. Here's my question for you. They asked the nurse, ¿Nos puede ayudar? Can you help us? What do you say to someone? Are the resources being made available, Dr. Pluguez, that you feel and you've seen can really make it equitable for everybody?
No. I mean, that's the simple answer. No. We need more nurses. We need more providers. We need more people. It's something I've said frequently. We need more boots on the ground. We need to be able to reach the community where they can be reached. Once you're in the hospital, yes, there's providers like myself who go to the bedside and assist patients. If it takes me 15, 20 minutes to explain something about their care and in Spanish, I'm absolutely available and willing to do that. And there's lots of nurses like myself who speak Spanish. I'm in the Philly region, South Jersey region, and there is a larger population of Spanish nurses than there would be in other places, let's say even within New Jersey itself.
Do you find that you have to perform duties that are beyond the scope of work, if you will? And I hate to be so simplistic, but I want our audience to truly understand the hours that you're having to work and what you're being asked to do, Doctor.
We all do.
Yeah.
We always need to take the next step. If we don't do it, who's going to do it? People don't understand the language, don't understand the system, don't understand. I'm sorry that I'm interrupting.
No, that's okay. That's okay. So you heard Rodolpho. Melissa, your thoughts?
No, absolutely. He's absolutely right. We not only do we do it, but we do it with love in our hearts and because we are there and we are available. I have been called from other patients' bedsides, have to finish with one patient as a nurse practitioner, and then called to go try to explain dialysis care because the nephrologist is there, the phone can't be used, the person's not understanding what they're saying on the phone, perhaps it's not quite the same language. And we always think about translation and interpretation, but if you have, let's say, a Venezuelan interpreter who may be saying things slightly different, but you have a Puerto Rican patient whose hearing is probably not so great, and is just not understanding kind of the basics of the language that's happening, then I'm more than happy to go and do that, even if it means that I'm staying later, finishing my work later. Even for some of our nurses who only speak English, they know when I'm on schedule, they see my name and they, will call me and be like, can you please just talk to this patient? Somebody talked to them earlier that day and they just didn't understand what was happening. But this is basics. This is not even COVID. This is everyday life.
And guys, I know this is commonplace to you in everyday life, but for us who are not in your space, this is such an eye opener. We're like bobbleheads. I see a lot of this going on. Dr. Shapiro, you were doing this when Dr. Pluguez is talking about the reality today. So my question to you is this: are we applying and seeing proportionate resources? You spoke and you heard Dr. Galindo say he's at a county hospital, he's at a private hospital. What do you see in LA?
It's painful that even here in California, we see the way that this pandemic has actually been killing our families. And there's no other way to say it. It has been a massacre.
Wow.
And a lot of people actually think that this virus attacks, underserved communities, but in reality, and it's actually designed for that. In reality, this virus only looks for weaknesses in the society.
Stop.
The
phrase
yes.
you use right now, may this be a moment, mis amigos, por favor en español. He called it un masacre. I mean, I've never heard it described that way, but you're there. You're witnessing it, Dr. Shapiro. This virus is a massacre on our community. Explain
completely. If you see what actually is happening right now, that, after decades of problems that we call social determinants of health, lack of proper nutritional value foods, as Dr. Galindo is pushing out and sharing with us, the problems that we have with translation and actually getting care, and problems with education, and all those actually start like weakening our communities, and we have depression, anxiety, obesity, and other stuff. That's why when you have a pandemic, a stressor in our communities, all the toxic stress, all the stuff actually ends up on hospitals. And that's why we are out there, and we cannot stay home, because if we stay home, there's no food. Then
But let me
yeah.
be clear about something to all of us who are in this room, and I want to include myself. We're not here out of an attitude of negativity. What you're hearing is the reality, because knowledge is power. And I so appreciate that everyone here is giving us the unfiltered, real-time realidad. Forgive me for the redundancy. Dr. Shapiro, I don't see defeat in your eyes or your face. How do you keep going?
David, when you go to an intensive care unit right now in LA County in the past weeks, when you see the majority of the beds actually being applied for Hispano patients, and we see that the amounts of patients that are Hispano that have actually part with COVID-19 in the past weeks, it's the hope is there. The hope is that we actually can make a difference. And I'm fighting for this pandemic, and I'm fighting for all the other pandemics that we'll be fighting. And we can change the name. We can call it diabetes. We can call it, problems with obesity. We can call it toxic stress. All these things now, it's an eye-opening moment for our communities. And again, the phrase that actually comes from my heart is that we need to start vaccinating our communities against fear with a dose of truth, because this is the moment that we have the choice to go back and go like, well, yes, there were a lot of problems, and say we did something, or there was a problem and we stayed the same. And if we stay the same, we're going to see the same results always. And that's up to us.
Doctor, before I began this conversation with each of you, I had to turn my camera off, walk away, and catch a few deep breaths just to lower my level of anxiety, because we're involved in so many things that we often forget that we're really here to talk about vidas, lives. I want to go to Aracely. You mentioned two words a moment ago. You talked about, or someone did, anxiety. I heard the word depression. Aracely, cuando papá no puede sostener la familia, when mamá cannot put food on the table, when the father cannot provide, my God, we're seeing so much stress in the families. Again, we're not being fatalist here. Help us to understand a way forward. What can we do, Aracely?
So I have to say, and I'll say it in Spanish and then in English, a mí me da más ganas de luchar y luchar con más fuerza, right? It just gives me the courage to fight, and to fight harder in the field and in the space that I'm in, to make a difference for our community, because I am tired of us surviving. I want us to have full lives. And yes, we are seeing an increased incidence of domestic violence, violence against children, because there is increased anxiety, depression, and pressure on families. to put food on the table. There are single moms. I was a single mother quite a while ago, but I cannot imagine having to face a pandemic where my child cannot go to school and I cannot go to work because I have to look after my child, but then I cannot work because I have to teach my child or oversee. So the roles that we are being asked to fulfill at home during the pandemic is quite challenging. And
so
then
what are
you
the
add-
resources? What are the resources that if you had your wish list and we're going to take it to the White House or Congress today, what would be the top 3 items on your list of resources? You come from the Center for Responsible Lending. You're looking at the economics of COVID. I mean, the cross section, the intersection. What are the 3 things that you would say are the top 3 you need?
I want to relieve the pressure of the financial needs that families have. So I want them to feel that they have the money, the financial resources they need on a monthly basis to meet their financial obligations of covering food, shelter, and other obligations. I would want to make sure that housing is covered, that food is covered, that healthcare is covered, and that we are actually doing the production necessary so that all systems are also being fed
Okay,
in the
so-
supply chain.
So I'm going to stop right there, guys, and thank you for your patience for allowing me to keep doing this. You who are watching this may not be in any of the spaces you've heard described today, but we can all take this instrument, the most powerful one we have, and we can contact our elected officials. Aracely, does that help? I mean, you're in that space. Todo es política. Hasta el precio de la tortilla, even the price of a tortilla is political. So can we make a difference as a community?
Absolutely. All of the elected officials, from your local elected officials, state elected officials, and federal elected officials, are making decisions over the resources that doctors, nurses, teachers, and we as individuals and as families receive from what we contribute to the general pot.
But you know,
So-
Dr. No, thank you. Thank you for that, Aracely. I must ask Dr. Galindo, and I know that we're kind of jumping around, but this is related to what Ms. Panameño just pointed out. You're dealing with chronic disease in the patients you're looking at. Aracely just talked about resources that are necessary. But let me ask you this. There are some people who think, oh, the worst is past. You just heard Dr. Shapiro say we have to prepare now for whatever that new pandemic is. It could even be looking at diabetes like a pandemic. Talk to me about where we are in that timeline as you see it. When are we going to be past COVID? What do you think?
So the question is on a very high scientific level, right? So I don't think that scientists are ready to get rid of viruses from Earth on 2021. So we had not gotten rid of HIV, we had not gotten rid of flu. So this is a virus and it's likely to be here. I think the point, and this is a topic that I would love to discuss, is misinformation by reading the web.
Okay.
So in the old days, when my grandma just made it to 6th grade, right? So she was following the experts. She was listening to experts that were trusted people. Now
Yes.
people just watch a YouTube video and believe that whoever is talking there has the true scientific fact. Reality is misinformation plus lack of cultural translation, and lack of translation is making the whole system very complex for our community. So I don't expect, and my colleagues, many infectious disease specialists don't believe that we're going to get rid of COVID.
Infectologos, I think, is the word I've heard. Yeah, go ahead.
It's going to be better.
It's going to go away, huh?
No, so that is actually not based on scientific facts. So HIV came many years ago, and it's still here.
It's still here.
We just learned ways to make it better and safer, and we can survive it, right? So we just do things to make it better and less lethal. But reality is, it's not gonna go away. I mean, I'm hoping for the mask to go away soon, but still, I don't think that. I think it's gonna get better, and I'm truly hoping that with the vaccine, we're gonna be able to control the rapid spread, which is one of the biggest concerns of this virus, is spread very easily. And then if you get severe diseases, it's severely lethal, you know? So,
Okay, I hear you, Rodolfo, Dr. Galindo. I hear you con todo aprecio, with much appreciation and respect. Melissa, you and Dr. Galindo, you who work on that front line together as a team. He says it's not going away. So what's the reality for nurses going forward? I mean, it's become such a high risk space. Melissa Pluguez, I want to ask you the question. Where do we go from here in terms of the people on the front line like you, the nurses?
We have to continue educating our patients. We have to continue spreading the message, you know, saying that we need to lobby our representatives. We need to have those vaccines available. We need to make masks available. I remember at the beginning, that was a huge struggle just to get masks out to the population. You know, at every step in the way that we've done this, we've encountered new barriers and new ways where we realize how we are failing our people. We need to do better.
Okay. Oh, yes, Dr. Galindo. Yes, go ahead.
I think that we need support from organization, state, and the government, but the resources that we're asking for is not for us to spend, it is for use it by people to know how to use it in our communities. Example, it's not just getting funds and money, it's creating initiatives that help and target culturally our community. So the vaccine, the way to register to get a vaccine right now in many health systems is to go online. All right, and Dr. Shapiro was mentioning this. It's not just knowing English, it's being able to walk through the the computer system and pass all the steps. So the allocation of these resources cannot be to people that make decisions for the whole. It needs to be culturally tailored to our community, people that understand our people.
So let me ask you this, Dr. Galindo, Dr. Shapiro, and I'm going to go to Dr. Shapiro. I heard last night that there are many people who are calling for neighborhood pharmacies to be added to that layer of distribution because they have logistics. By golly, they can deliver crackers to a neighborhood. Why can't they deliver vaccines? Your thought about things like that?
David, we have so many community partners on the ground already. We have, amazing promotoras. We have community health specialists.
What is a promotora? For those who don't know it, what's a promotora?
It's someone on the community that is voicing out information, and we have been using promotoras services for a lot of years. For example, to fight against diabetes, to talk about screenings against cancer. That way, someone from your community that understands your language, that understands where you live, is coming to you. Then, for example, we had a lot of good, amazing things right now with diabetic patients that were having COVID, could not get their vaccines, the medications, they could not get food, and promoters actually help bridge all that social gaps, all that social determinants of health. That way, they can manage actually the diabetes. It was not that they didn't want to, take care of their diabetes, but they needed more support. And that support, we already have it. We have community clinics that have been there for years. We have, places like LULAC that is actually opening this type of platforms to actually voice the concerns from us. And they need to hear the voice of the customer. It's awesome to do a strategic plan on paper, but when you need to translate it to the reality of the ground, it's a different picture. And they need to have some type of cables or whatever thing inside of our community to hear what's actually happening. And to make the changes. Nobody has done this before, and we need to recognize that. Nobody has passed through this pandemic the way that we have been living it. That's why we need to have an ongoing conversation on what actually is working and change it and do it more. And the things that are not working, actually to change them. And that's okay. But we need to have that conversation in that forum.
Okay.
David,
Aracely?
may I?
Yeah, no, in fact, I was going to come to you next, and I was going to ask you, as you answer and add to that comment, I want to ask you and to roll in something. He said, hey, we've got partners, they're already here. So in the space that you're a specialist in, the economics of a family, Familia Latina, help us to understand long-term strategic changes of behavior that need to be incorporated so that healthcare, financial priorities, and so forth all come together. Please, I give you the floor.
So I wanted to comment to what Dr. Shapiro was just talking about. And it's about this part of the conversation where we actually have to acknowledge what has gone wrong in the past. I used to, prior to working on financial services and the economy, I was the founder of National Latina Institute for Reproductive Health. And so in the health field, we have to acknowledge that there have been certain things that have happened to Latino women and other women of color and other people of color in general that have been unjust and unfair. And if it is in the health space, we have to acknowledge that to try to overcome what that is. Most recently, so I won't go all the way to the long-term history, but most recently, we heard about undocumented immigrants captured at the border that were subjected to specific procedures against their will in where they were not providing informed consent, whether those were, sterilization procedures or other procedures.
Georgia was one of those areas that we covered. LULAC was involved in that. Please continue.
Exactly right. And so my point with that is that that was being done by people representing government. And so here we are trying to intercede in a pandemic, trying to promote a vaccination program through vaccine programs that have been developed and incentivized by what was called the Warp Speed program to produce vaccines. And so at what point do regular Maria y Jose out there in the community are gonna say, the government in the past has sponsored or agents of the government have actually conducted certain activities that were against our well-being. And we have to deal with that. We have to confront that. We have to acknowledge errors, and we have to try to encourage people to now take the facts and move forward for their well-being and the well-being of our communities.
Well, this is why I was asking Melissa, and I want to come back to Dr. Pluguez again with this question. Nurses are often the most trusted person-to-person contact in a healthcare setting. Look, when I go to my doctor, the first person who sees me is a nurse. She's getting all of my data. She's asking me all kinds of questions. And I frankly don't like changing from one nurse to another. You are a trusted purveyor of that kind of information. Your members are, Dr. Pluguez. So address that point of overcoming skepticism because of past errors, mistakes, even abuses. How do we do that? How do we overcome that?
We have to be able to provide the information clearly. We have to be able to provide it in a culturally sensitive manner. We have to be honest. It's true. It's the injection of truth against fear. Absolutely, like Dr. Shapiro was saying to us. There are a lot of misconceptions when it comes to the COVID vaccine. And unfortunately, we can do absolutely everything right and have a million vaccines ready in every township and every area across the United States. And that's not going to do much for us if only 50%, 60% of the population trust us enough to give them that vaccine. We have to start really addressing the misinformation that there is about the vaccine. Just because the vaccine was done under warp speed, like they say, doesn't mean that any important steps were skipped or that it's been proven to be unsafe. Just because you're showing up to these health centers doesn't mean that we're looking specifically for undocumented personnel to be able to just go ahead and, whisk them off in a van and take them away. It doesn't change your DNA. We're not putting tracking devices into people. We need everyone to know that we are doing this because we care for one another. But the information has to be provided in Spanish. It has to be provided in a mass media sort of way to be able to get them to trust us and really understand that we're doing this because we love one another and we care for our people, for all minorities, and basically everybody, because we are one large community in the end.
I really want to thank you for your transparency on these points. Our topic here, COVID-19 and efforts to vaccinate our communities. In these minutes that we have left for this conversation, I so appreciate all of you being here. I want to begin with Dr. Shapiro. Let's look forward and let's give our audience some homework, things that we can all help do, things that we could carry forward in our space with our families, our friends, our extended families, and so forth. Help us with tools that we could look forward to use and how we can make them better. Dr. Shapiro, you have the floor.
David, the most important thing is to ask, and after that, ask and ask. It's okay to be afraid. It's okay to not understand things. It's okay. But there's people that the people like you have here in front of you, like Aracely, Dr. Pluguez, Dr. Galindo. We are here to help you in any way that we can. There are many more Dr. Shapiros there, and you can put any name that you want. There's a lot of people in front that we want to help and actually translate information from the medical-ish to an information that you can create something for you and your families. Then asking and being represented is the most important things that we have right now. It's okay to ask, but it's very important not to share information that has zero value. You will get tons of things in WhatsApp chains, Facebook channels, Instagram. Then there's a lot of things that they look like a miracle or like something horrific. We need to have something in between. Then do not send it again. If it sounds like pseudoscience or like a miracle, just wait, have a conversation, and we are here to create that.
Thank you, Dr. Shapiro. Dr. Galindo, I give you the floor. Look forward, give us homework, give us a task that we can help you undertake as well. Dr. Galindo.
So the way we work is talking to each other. We like to share our experience. We like to share with our family, friends. So talk to each other and keep trusting your respected people, all right? The media is not helping you. The media is making money for themselves. So you talk to a trusted representative people within your community, which could be your doctor, it could be a friend that is in the medical field, and trust that person. The reason the vaccine was done in speed is because we have millions of patients affected by the disease, so they could be enrolled in the studies. When you do a studies and you have one patient every month, then you only can have one patient, but now we have millions of patients. So, and then the other thing is, don't mix science with politics. This is a disease, all right? Don't trust the right, the left, the middle. This is about your health, your family, and your friends. We are getting vaccinated for a million years, and we have saved humanity from deadly diseases by vaccines. I don't know who introduced the topic of vaccines, but it's not true. My family got vaccinated. And the reason we're doing it is because I don't want to make my extended family sick. I'm a healthy person. I may not get affected, but I don't want to get my extended friends and family affected. I want them to be healthy too. The only way we're gonna get this control is getting vaccinated right now. If we have a better solution in a year, good. Right now, this is what we have. And it's better than doing what we were doing before, just waiting for God to come down and take it away from us immediately in a week.
There you go. Thank you, Dr. Galindo. I give Dr. Pluguez the next opportunity as we wrap it up, the homework that you would give all of us from the perspective of America's Latina nurses, please.
Please call your doctor. Ask them if they have the vaccine available, if they know where the vaccine can be available. You know, if we're going to primary health centers or federally funded health centers where they have Spanish providers, perhaps make an appointment and see if they can help you kind of navigate through the websites and navigate through the information. But in the end, even while we're vaccinated and we're getting there and we're doing better, wear your mask. Wear your mask, wash your hands. Please protect yourself, please protect others, and continue to express your interest in getting the vaccine. The more people that we have that show they want it, the bigger of a push we can get, and perhaps we can get more resources in, understanding that we are crying out for this vaccine and that it is well needed in the Latino population.
Dr. Pluguez, thank you. Well, Aracely Panameño, we began with you, and I'm going to ask that you give us a closing thought on the homework that you can give us as a community and as individuals. ¿Qué podemos hacer? What can we do?
So the doctors and the nurses on this panel have told you about what you can do about vaccinations. And what I'm going to ask you to do is I'm going to ask you to share your story with those that make policy decisions that affect our lives, that make policy decisions about the resources that these doctors and nurses have at their disposal. So I'm going to ask you to not only wash your hand, wear the mask, stay socially distanced, get vaccinated when you can, but also get in touch with elected officials at the local, state, and federal level, and make sure that at every stage you share your experience. In my family, there are many of us who have gone through COVID, and so now everybody understands when the vaccine becomes available for any of us, you get it, because we're protecting each other. We're doing it because we love each other, not the immediate person, but the extended family and the community. But we also must let the policymakers know that we need more resources to come to our community so that it can be done culturally competent.
And
Thank
if
you.
I may, just a very, very brief follow-up. So you are optimistic, obviously, but we should not rely on hearsay. You say we should go to respected, authoritative sources. Did I get that correctly? In finanzas and healthcare, is that correct?
Absolutely, absolutely. There are resources out there. We must claim them. We must ask for them. Ask, ask, ask.
Thank you. Thank you very much. Well, you've heard it. I want to recap a few of the key words that I got in the last couple of minutes. Call your doctor. The word ask came up numerous times. Dr. Shapiro said talk. He said also share. Dr. Galindo spoke about the source. COVID is not political. And Melissa, you, Dr. Pluguez, you are so serene. And, you know, when I go to see a doctor and I see a nurse and I see you guys just doing what you do, con tanta calma y confianza, the calmness and the confidence, you're a blessing to us all. Our conversation today, COVID-19 and the efforts to vaccinate our communities, feel free to go to the LULAC.org website under the State of Latino America. There is going to be much more information for you to glean there. Look, we have been working at LULAC very aggressively to be informative to America's pueblo, nuestra comunidad, and others. We have a toolkit called Ayuda en Español. Seek information. We will make it through this. This is not a conversation of defeat. It is a conversation that through knowledge podemos lograr las cosas. We will continue and we will see it through. I want to thank each and every one of you, Dr. Pluguez, Dr. Galindo, Dr. Shapiro, and also Aracely Panameño. It's been a joy to have you here. Que Dios me los cuide y los bendiga. Thank you, and we will continue this conversation. I'm David Cruz. Thank you very kindly. We'll speak again soon.